Excellency, Honorable Chair of PPD, Ms. Lindwe Zulu, Your Excellency, Ministers present, Honorable Board members, the Executive Director of PPD, Mr. Adnan, distinguished panelists, delegates, colleagues, friends, partners, ladies and gentlemen, Assalamu alaikum, good morning, good afternoon, and good evening. I'm delighted and greatly honored to join you today for the annual 18th International Inter-Ministerial Conference on South-South Cooperation in Population and Development on the theme Promoting South-to-South Cooperation for Attaining ICPD and Agenda 2030. This year's conference serves an exceptional global and regional platform for discussions, peer review, knowledge exchange, sharing of best practices, experiences and approaches, networking, policy dialogues, and bilateral commitments to contribute towards the achievement of the unfinished agenda of the ICPD and SDGs, including the Nairobi Summit outcomes, through promoting and advancing the South-South and triangular cooperations among the PPD Alliance members, states, and other developing countries. First, I would like to express my sincere gratitude to partners in population and development, PPD, and UNFPA for jointly organizing this remarkable conference. This conference is important for scaling up and invigorating South-to-South triangular cooperation as a key accelerator to expedite the progress of achieving the ICPD and SDG agendas during and the post-COVID-19 era. Overall, the COVID pandemic has caused morbidities, mortalities, and severe damage to the world's economy, threatening gains already made, which has further slowed progress in PPD countries toward achieving the ICPD and the SDGs goals, specifically adverse impacts on sexual and reproductive health services, access, youth and adolescent services, and increased domestic violence. This has highlighted the need for further investment to be made in health, social protection, housing, sanitation, and hygiene to reduce the vulnerability of population to future disease outbreaks. Distinguished ladies and gentlemen, it is necessary to advance policy dialogue through South-South and triangular cooperation and use South-to-South and triangular cooperation to address the challenges that affect population and development in developing countries, particularly in the 27 member states of the PPD, and now the country, Philippines and others who want to join us. Strengthen this critical role of South-South and triangular cooperation in a post-COVID context as a key accelerator in global advocacy, knowledge exchange, technical cooperation, and capacity development toward achieving the ICPD and SDG can sustain the achievement made by the PPD members countries in sexual and reproductive health, gender equality, youth empowerment, population and development. South-to-South and triangular cooperation is vital to ensure solidarity and cooperation in our quest to address our common critical challenges, especially arising from pandemics and climate-related challenges. His Excellencies, distinguished guests, ladies and gentlemen, Kenya was among the United Nations member states who recommitted to advance the goal of the ICPD program of action at the Nairobi Summit on the ICPD, aimed at ending all preventable maternal deaths and met need for family planning and gender-based violence and harmful practices against women and girls by 2030. President Uhuru Kenyatta presented Kenya's 17 commitments during the summit and mandated the National Council for Population Development to monitor and track the progress. The first step that Kenya took to actualize this, the implementation of the country commitment, was the establishment of a national task force for a wide range of partners across the divide and development of an action plan that stipulates the key actions that the country will implement under each commitment during the decades leading up to the year 2030. Progress toward these commitments is reported every year through a report published by NCPD, the 2019-2020 and the 2021 Kenya report on the implementation of the ICPD 25 country commitments were launched during the ICPD 25 anniversary celebrations marked every year. At the event, representatives from various government ministries present a scorecard on achievement made over the past year. The report strongly promotes South-South cooperation as the accelerator in the RH, population and development for achieving ICPD and SDGs. The South-South cooperation for improving universal access to productive health and family planning services, addressing gender-based violence through sharing the best practices, harnessing demographic dividends, preventing maternal death in developing countries, and investing in the centers of excellence in population and development. Distinguished ladies and gentlemen, the principal aim of this conference is to strengthen South-South cooperation, SSC, for deepening national commitments and integrating pertinent programs in the national policy for achieving the unfinished ICPD agenda and the SDGs, including the Nairobi Summit outcomes. Kenya is on track in implementing the Nairobi Summit commitment, but will require refined strategies to maintain momentum amidst the emerging challenges such as the COVID-19 pandemic and the climate-related issues. During the 2020-21 reporting period, Kenya made the following key achievements. Number one, more than 1 million vulnerable citizens benefited from the government cash transfer program channeled to vulnerable population under the Inua Jamii program. They include persons living with disabilities, orphans, and vulnerable children, as well as the elderly. In the year 2020-21, the government plans to continue supporting more than 1,233,219 households with a cash transfer program targeted at the vulnerable population in the society. Two, operationalize the National Social Protection Steering Committee, registered over 348,000 new members to the National Social Security Fund. Strengthen the policy framework, advocacy, capacity building, commodity security for universal health coverage, Linda Mamba program, and the National Health Insurance Fund. Number four, the productive and maternal health dashboard was developed and put into use. This dashboard attracts commodity use, service, delivery, and training. Number five, capacity building of 142 institutions on provision of quality and timely data for decision making. Number six, enhanced advocacy and communication campaign was done for adolescent and young people agenda during the COVID-19. Community handbooks for adolescent, parents, and community leaders with critical information on COVID-19 prevention, life skills, life goals and choices, SRH, nutrition, HIV preventions were developed and disseminated. Number seven, on the commitment to attain basic universal education, substantial progress was made during this period, including the recruitment of more than 10,000 teachers through the Teacher Service Commission, as well as school infrastructure improvement in more than 5,000 public schools across the country. Full implementation of competence-based curriculum with focus on enhancing access, relevance, transition, equity, and equality was also implemented. Number nine, completed and put in operations 119 new technical colleges across the country. On the commitment to eliminate form of gender-based violence, including child and forced marriages, by 2030, all the regional offices, that's what we call the 47 counties, have strengthened prevention and response mechanism through training and sensitization activities carried out among the community members, medical practitioners, judicial system players, and law enforcement officers. 3 landmark declarations were made by the elders from communities in support of the female genital mutilation. The report further showed that more than 1,662 pregnant and parenting girls in some of the counties, to name them Homa Bay and Narok counties, were supported to return to school through a track, talk, and return to school initiative. Gains were also reported in harnessing the demographic dividends and empowerment of young people, with more than 200,000 youth benefiting from government programs on entrepreneurship, skill training, education, internship, and employment opportunities. For national development and the Kenya Demographic Dividend Roadmap to align with the changing socio-economic landscape and integrate ICPD and finish agenda to achieve the 2030 agenda. Finalized negotiation of bilateral labor migration agreements with the United Kingdom and Saudi Arabia. All county gender technical working groups were strengthened at the regional level, and to provide 272 advisories to various institutions on opportunity for promoting gender equality and freedom from discrimination. In number 17, we also in number 16, we integrated ICPD indicators on a digital platform to ease monitoring and reporting across the various sectors and ministries. Distinguished ladies and gentlemen, the severity caused by the COVID-19 pandemic and the rising emergency demands They create larger funding gaps for implementing the ICPD and SDG goals. These calls for advocating for mobilization of resources at all levels, domestic, regional, and global, and the establishment of South-South financial mechanism to address our shared challenges and strengthen the national capacity of developing countries to produce new medicine, vaccines, medical devices, and equipment for reproductive health, family planning, maternal child health, and the access made available to all South-South countries to save millions of women, infants, children, and to achieve global targets by 2030. The quality of cooperation between member countries is of vital importance toward effective fighting against these challenges arising from the pandemic and other humanitarian emergencies. Distinguished ladies and gentlemen, as member state of South-South cooperation, Kenya supports South-South cooperation for global solidarity to see South-South countries working together to pursue common goals of ICPD and SDGs by rallying around the 4 basic principles: scaling up best practices, knowledge sharing, mobilize resources on recovery of pandemic, enhancing policy and program space, and building capacity for resilience. This includes expansion of institutional capacity and the Center of Excellence to promote exchange between professionals to bridge the gaps in research, advocacy, and policy intervention. Kenya strongly supports efforts for development of effective Center of Excellence on South-South cooperation for building capacities in population and development and maternal and child health. Distinguished ladies and gentlemen, Kenya is a member of the Network of African Parliamentary Committee of Health, NEOPACAO. The NEOPACAO meeting organized by the PPD ARO provides an excellent opportunity to follow up on RH and population and development related commitment with parliamentarians that enhance the achievement of ICPD program of action, SDGs, and FP 2030. It's also a forum to showcase successful experience by members of countries on the role of parliamentarians in promoting reproductive health development programs by mobilizing domestic, political, and financial resources. Excellencies, distinguished guests, ladies and gentlemen, to accelerate progress for the ICPD and 2030 agenda, we need to strengthen South-South cooperation for post-COVID era, partnership building amongst the member countries and other development agencies for global solidarity, innovations, political support, and evidence to create sustainable financing momentum to reach the planned goals and targets. Distinguished ladies and gentlemen, the government of Kenya remains committed to promoting South-South triangle cooperation. The government will continue to provide an enabling environment for greater participation in South-South cooperation for implementation of policies and programs for achieving the ICPD program of action and 2030 agenda. I thank you.